everybody. I'm going to be talking about education and work and trying to fix my hair, make sure it looks okay. Forgot to put my lipstick on, so you have to forgive me. This is the lecture before we move into the comp. And so just kind of want to go through some of the things that are related to this and kind of walk through the information that's available for you in your text. And then if you have any questions, please just email me. I know it's kind of looking like I'm not looking at the camera. The camera's there, the screen's right there, so I'll do my best to make it look like I'm talking to you directly. So again, if you have any questions, just email me back and do go through your text the appropriate chapters for the reading. Okay, let me make sure I get all of this correct. There we go. So when we talk about education, of course, we go back to those 8 areas of occupation. On the slide, you'll see those, what consists of education according to the OT practice framework. Formal education participation, which is what you're doing right now. Informal education or interest exploration. So that would be just kind of like seeking information out, going to an intro seminar, and informal personal education participation. That would be like your CEUs, okay? And then beyond that, what we're taking and what we're doing is we're looking at how we can acquire skills for success and for work as we move forward. Now, we do this kind of in a logical way, depending upon where we fall in our age category and with milestones. And we build as we move across our lifespan. So skills and habits that we learn during our childhood begin to lay that foundation of how we move forward and how we progress in our educational process and how we approach education in particular. You can imagine that if we have a breakdown in hitting or achieving a milestone, or we don't have a role model in what we want to do, that achieving some of these milestones or acquiring those skills for success in school and in work can be a little bit more difficult. And when that happens, that's where occupational therapy can come in, when we have that break in between, or when we don't have an opportunity for someone to learn a skill set. When and where possible, depending if we've got people that are needing to learn a role related to education or related to work, there's lots of different things that we can do, and some of those examples are listed for you on the slide. If we layer on top of that, then issues and concerns related to a person's ability to perform, such as a mental issue or emotional or cognitive disorders, then we're going to see not only just flat out skill development issues, just because people don't know how to do it, but how they actually process the information and approach the information is really important. So things like, executive functioning. If I can't sequence the steps out, or if I can't think of or problem solve my way through a situation, let's say if I can't get the class that I need if I'm trying to schedule for college, or if I don't have an alarm clock and I don't know where to go get an alarm clock and I don't know how to set it up, all those kinds of things. Multitasking, memory, just are, even if you think about all of those nonverbals that relate to communication, those are the kinds of things, again, where occupational therapy can make an impact and make some changes. People who don't have that skill set simply because they've never had the opportunity to learn, or they have a skill set, and they have those mental, emotional, or cognitive disorders that have impaired their ability to apply or do new learning. That's where occupational therapy can really impact the delivery of that. So again, the slides have more information that here, like post-secondary students may academically be ready for college, but the ups and downs of a mental illness interferes with their management in that student role. And then looking at how stress plays into their ability to cope and interact with their classmates and get their homework completed. What if a glitch happens, and let's say they have a computer issue and they're not able to upload their homework? Do they know how to problem solve their way through that? Or let's take a look at, as mentioned here, medication management. And if they have side effects of their medication, they've got an 8 o'clock class, they have a medication that they have to take at 7 o'clock in the morning that makes them sleepy. So it's not that they can't do the class, it's that there is a issue with um, that side effect of that medication interfering with the performance of a task that they need to do. So helping them kind of problem solve through that. I'm going to let you kind of read through some of these slides. You have them already, so I'm not going, because these really give you examples of how we can support and develop readiness. And I'm listening over my shoulder, and I think I have somebody coming in just in a second to empty my trash. So if you see me, take care of that. That's what it is. Yep, I hear something. Anyway, so again, here's more information about how to support or develop readiness for the student role. Again, we can offer assistance with things like homework prep and completion, looking at anxiety management and stress management strategies for test taking and note taking, working with the other supports and resources that are available at the school. We can begin to look at things like sensory regulation issues, and even moving more towards vocational training, specific job readiness skills. Okay. In addition, then, just to kind of the basic components of the job, we have issues related to communication, and not speech related communication, like the production of language. It's really not what we're talking about. We're talking about reading the environment, understanding social cueing, making sure that they pick up on the nonverbals, or things like impulse control. Those aren't speech production issues related to communication. These are all the things that have to do with those things that surround how we communicate and how we gather information and how we read the environment and read the people around us to gather the information that we need in order to be successful. OTs and OTAs can definitely have an impact and work within that. And those social skill communication related training issues are things that are important for us to address. Now, in consideration of all of that, it's important that we take a look at how a person learns. We go back to, are there cognitive, emotional, or mental impairments or concerns that we need to address? So they used to learn one way, now they learn another way, or this is how they've always learned, and we need to consider, are they visual learners, are they auditory learners, are they a combination of those plus kinesthetic, but match that instructional style, get that just right challenge to what that individual needs as they begin to look at educational participation and work participation, because they'll take the cues from you as being a role model on how they should begin to interact with other people. And those are things that you should measure. How much cueing is required, how much prompting, what types of visual supports are necessary. All of that is important, understanding the person's learning style and then helping apply that to the intervention session that you set up. Now, this is just some information about supported education. I'm going to allow you to read through that in your text because they just give you some different ideas. Self-contained classroom, on-site mobile support. I'm going to flip through those slides because this is stuff that you can work with on your own. Because I really want to get into the meat of this and where we're really headed with your comp coming up is work. Okay? And work, according to the OT practice framework, involves a lot of different things. And it can be actual work employment issue related kinds of things, or it can be prep work. So actual paid employment all the way down through volunteer participation. So we can have full-time, we can have part-time, we can have full-time volunteer, we can have part-time volunteer or weekly or hourly volunteer. All of those things kind of come together to help prepare a person for work participation. Okay? One of the things that's important to understand specifically in regards to mental illness is, if you think about it, in some capacities very similar to ADLs. It's not like a person doesn't know how to do certain things. It's either whatever issue they have in their life right now is making it difficult for them to do it, or they need further opportunity to practice and think about big picture versus just the small components. Many persons with psychiatric disorders have problems with work and work performance. Now, let's talk about the small things. Let's talk about anxiety. Let's talk about stress. Most of us have those things. Most of us work along with those things as it relates to employment and productive work or volunteer work, which is also productive. But then you layer that, the next level on top of that would be dealing with depression, significant depression, or bipolar disorder. All right, and you know the symptoms that come along with that. You need to be thinking about how might those symptoms interfere with performance. And then we'll go up to the next level, and now we'll be talking about more along the lines of schizophrenia, or there's more organic brain disorders, which carry much more significant symptom management along with them. Okay, depending upon how long a person has been dealing with this, we think about and how old they are. When they're in an active disease state, or if they've been chronically ill and intervention's been very difficult, their experience with work and work behaviors, effective work behaviors, may be limited. Again, it's not that they don't know how, but it's just the opportunity to practice and to make mistakes has been limited. So that's where occupational therapy has come into play. When you're dealing with work and when you're dealing with with education, a great evaluation tool, you can look at MOHO, or you can look at that COPM that relates to PEO, because really we need to kind of get an idea of what are your feelings, what are your thoughts, what are your concerns. Remember, those questions are super important because we don't want to lay over what we think you should do with asking them about what they've already experienced, what they know, and what their concerns are. We need to marry those two things together. Work evaluations, you know this, are really designed to address both work potential as well as history. Where the idea is to help with any transitions that are necessary to allow for effective job or work performance. Now, let's reflect back a little bit on that, on the ADA. This is from last semester, so let's pull that forward. Remember, Title I from ADA protects persons with physical and mental impairments from discrimination in employment due to disability. Okay, so that means just because you have or disclose a mental or a physical impairment does not preclude you from actually being eligible or working in that particular environment. The issue always becomes down to essential functions. Are you able to do the minimum job requirements as posted? Okay, doesn't really necessarily matter how you get those things done. It's just, can you get those things done? Okay. If you cannot do those things, or an undue cost or an exorbitant cost is required of the employer, then it may be a job that the person with a physical or mental impairment are not eligible or not qualified to do. What you can do as the OT or the OTA is work to address some of those questions and concerns, and practice those job-related skills to help a person determine what their skill set is. And so when they look at potential employment opportunities, they're making smart decisions about which jobs to apply for and which jobs just to kind of say, you know what, that's not for me where I am right now. Now, we can do this in multiple ways. One of the ways that we can do that is teach a person how to advocate for themselves. So you know how to do that for a person with a physical health issue. You may not know exactly how to do that for a person with mental health issue, but it's very similar. Or let's say a person with a mental health issue and a background that includes a criminal history, because sometimes, not all the times, those things go together. Or let's say a background of a person with mental illness who was a significant mental illness who is also experiencing homelessness. You go to apply for a job, they're going to ask you for an address. If you don't have an address, there's a problem. So, working with the current systems and structures in place to teach a person how to answer questions, knowing what questions are okay to ask, what questions are not okay to ask, to be able to say, you know what, this is my skill set, this is what I'm really good at, and teaching and helping a person advocate for themselves. When we do that, it helps an employer both with identifying if job modifications need to be made, but also seeing the true essence of who that individual is. That's an important thing that goes along with ADA. Why do we work? Why is education important? Think about the number of people that you've seen as Walmart greeters that are above the age of 75. Might they be doing that for a paycheck? Sure, absolutely. But it gives purpose. It is the reason they get out of bed in the morning. If you have a purpose, you feel like you're contributing to society, you're making a difference in a person's life. So beginning to focus on education as it leads to employment, to focus on work, is a really important thing to do. And it's an area of occupation that is oftentimes overlooked, but it needs, especially if you're working with students in that younger age or adults in that, let's say, 19 to 64 kind of an era or age range, you need to pay attention to that. This is work and education are a really important area of occupation to make sure that we cover. All right. Oops. There we go. All right. We've talked about that. So let's talk about work potential evaluations and the role of the OTA. So a work potential evaluation is an evaluation that's used to identify a person's readiness or level of readiness for work participation. As you can see on the slide, we're looking at things like attendance. Do they show up consistently? Do they show up on time? When they show up on time, can they manage themselves to the point where they can get the work done, or are they productive? Do they get along with their coworkers? Do they get along with their boss? If they have an issue with their boss, do they know how to follow the chain of command and speak in a way that is both respectful of who they are, but also that person's position and authority over them? All of these things are important when we're looking at a work potential evaluation, because then for the OTA, it helps identify what areas you need to work on when you identify areas of concern. One of the ways that we do this oftentimes is simulation. We actually put a person into a simulated job environment and see how they do. When I was, I think it was summer of maybe it was either summer between my senior year of high school and my freshman year of college, or between my freshman year and sophomore years of college. I worked as a checker in a grocery store. And so when I went to job training, they had us do job simulations, and I actually had to go through. They had in the training center, they had a full cash register, and they had the line, and you had to scan everything, and they wanted to see what your work potential is, and they ran you through a simulation to see if you could handle the stress, to see if you understood how to work the equipment, that you could remember how to work the equipment, that you could problem solve if an issue or a concern came up. And that was part of the whole work potential process to determine if I was a good fit for that particular grocery store. So we as OTs and OTAs do the same things with clients, or can do those things to identify what are the issues or concerns. Now, we already somewhat do this here in the classroom, like when we have you simulate through comps, or if we have your demos or their presentations, we're practicing or pretending to see how you're going to do as the OT or the OTA, as the OTA in that environment. So we're actually putting you through a work potential to address any area evaluation to see and address any areas or concerns. So you actively have participated in work potential evaluations as the student. A vocational evaluation then helps us, it's kind of an extension of that work potential evaluation, is taking a look at, okay, so now we know what's potentially you're capable of. Now let's get a little bit more specific on actual jobs, all right? These are some examples. We can do job samples, work sim, we've talked about that. We can actually put you on a job and see if that works. Hello, field work, right? There's your realistic assessment right there. Or we can even just try a variety of different things. Yeah, hope that helps. So what are the roles that an OTA has in this, in work and education? Same roles that you have in anything else. First of all, you can assist in the evaluation. A standardized evaluation, you can participate, you just can't interpret the results. They can ask, and those are the kinds of things that you typically see in an education evaluation or a work potential evaluation. But also, you can participate in other kinds of things as long as you've demonstrated service competency and you present the results back to the OT, and they take that information and develop the evaluation. Advocacy training, task analysis, job training, development of interventions, all of it's the same stuff that you do. It's just under the umbrella of education or work in terms of area of occupation or area of focus. So these are just a few examples of things. We have OTs and OTAs that work in sheltered workshops, people that fall on the intellectual disability spectrum or fall under autism spectrum, that work closely with clients to figure out what jobs are that they're qualified for, what jobs that they'd like to see, and try. You can see some examples of some things there. And this just goes into further detail, so I'll leave that up to you to read. It's pretty much straight from your text in that capacity. Job performance skills, we can look at, again, basic work behaviors, initiating the job hunt process, practicing interviews, develop or problem solving through what a resume looks like, all of that. Begin, developing schedules, making sure people get up on time, making sure that they have transportation to get to work, making sure that they know what to do when they have a difficult coworker. How do they handle it? You don't want to pick up a can at the grocery store if you're a shelf stacker and haul it across the room and chuck it, right at your coworker if you're mad at them. You really want to have that conversation because you really don't want to get arrested for assault, right? That's not a good thing. So if you're mad at your coworker, what do you do? Or if you feel like you're the one doing all the work, what do you do? How does that work? That's part of those conversations that we can have. One of the interesting things that we can do also, we talked just briefly earlier in some classes about groups. Here's some example of different kinds of work groups. Now, you guys have been to Park Center. You've seen what's available at Park Center. These are examples of groups that they actually run over at Park Center. Clerical groups, service groups, work adjustment groups. These are things that we're currently doing. It would be lovely if they still had OT at Park Center. We currently do not full-time, but there's a great opportunity for OTs and OTAs in that type of an environment because these are exactly the kinds of things that are needed. Sheltered workshops, we've briefly mentioned those. If you've, the name just escaped me. New Horizons, I believe is the name of it. It's a sheltered workshop program near the airport, and it works with persons with intellectual disabilities. They do things like screwing tops on bottles and putting boxes together. And it's not minimum wage work. It's fairly routine. People typically don't work a full day, but it has been an area that has provided meaning for adults that have aged out of the school system to have someplace to go every day and to feel like they're contributing and helping and earn some money. Unfortunately, sheltered workshop programs are sort of phasing out because they're expensive to run, but there are still some around. Trial employment, transitional job. If you have a person who is interested in trying out a job or going to need some additional support, they can go work at Donut Den or at McDonald's or something for a period of time with a job coach. Let's see if that works. Usually for these kinds of things, it involves having an employer who's willing to give the individual a shot. Interviews are involved. So interview prep prior to these transitional employment or job sharing programs are important. How to structure things. This falls right along sort of the same line that we talked about with groups in lecture earlier in terms of that developmental group process. The lower the functioning person, the more directive the leader needs to be. So I'll leave these for you to read through. Here's our task group. Here's our work groups. Production line. I'll leave those for you to kind of take a look at as we move through. One piece of this that is oftentimes overlooked is that transition for retirement. And this is more of a community wellness type of a group. And sometimes for people making that transition from working to retirement can be kind of daunting. We do know that scientifically through research that depression can come along with that because you have a person who had a meaning and a reason and a contribution that they were making, and then all of a sudden things change. Now, if they have something to go to, say they've already lined up volunteer work or they know that they're going to help with their grandkids, that's one thing. But oftentimes people don't, and then there's questions of living on fixed income, and that's a concern. Or feelings of, I don't know what's coming next. I don't know what I'm going to be doing. So we actually have some wellness things that we can consider, and there's a role for OT and OTA in that. So that's pretty much what we want to talk about work and education. I know you probably have some questions about that. Lab will go into a little bit more about how you're preparing for the comp that's coming up. But I do want you to make sure that you go back, take a look at these different groups, these different roles, take a look at what the OT or OTA responsibility is related to education and work and how we can be involved. These kinds of questions ultimately do come up on the MBCOT exam, so that's an important thing to be familiar with. But hopefully when we get to lab work, we'll illuminate on this just a little bit more. Do let me know what questions you have, and I'll talk to you. Oh, let me get this later. Thanks. Bye.